Chapter 16, Depressive Disorder, Part 2. Nursing Process Assessment. So we have transient depression. And so with transient depression, depression subsides quickly and the individual is able to refocus on other goals and achievements. However, symptoms of depression can affect or alter four spheres of human functioning, and that includes affective, which is the blues or how you feel. Behavioral may include crying, right? Cognitive, some difficulty getting um, your mind off of your disappointment, or physiological, so feeling tired or listlessness. So symptoms at the level of continuum are not necessarily dysfunctional. So nursing assessment continued. We have mild depression. Symptoms at the mild level of depression are like those with uncomplicated grieving. So, affective, we have anger and anxiety. Behavioral, we have tearful regression. Cognitive, we have preoccupied with loss. Then we have our physiological or anorexia, insomnia with our mild depression. So, our moderate depression. So, symptoms are associated with dysrhythmic disorder, which is also known as persistent depressive disorder, and is an example of moderate depression representing problematic disturbances, which, according to our DSM-5 manual, is characterized by symptoms that endure at least 2 years. So, for our affective area, the person may experience helplessness or powerlessness. Behavioral, slow physical movement, slumped posture, and limited verbalization. Cognitive, retarded thinking processes, difficulty with concentration, and then our physiological is anorexia or overeating, sleep disturbances, and headaches. And then we have severe depression. So, when assessing severe depression, the symptoms include major depressive disorder and bipolar depression, which we'll go over in one of our future lessons. Affective, we have feelings of total despair, worthlessness, and a flat effect. Behavioral, we have psychomotor retardation, curled up position, absence of communication. Cognitive prevalence, cognitive is prevalent delusional thinking with delusions of persecution and somatic delusions, confusion, and suicidal thoughts. Physiological is the general slowing down of the entire body. So now let's move on to our nursing process for nursing diagnosis and outcome identification. So the risk for suicide related to depressed mood, feelings of worthlessness, anger toward um, oneself, misinterpretation of reality. And so I do want to emphasize as well with our suicide ideation patients or our patients that are at risk for suicide, maybe because of depressed mood or feelings of worthlessness or any of these particular nursing diagnoses. You always want to ask them, have they had any thoughts of harming themselves or had any thoughts of killing themselves? In any event that that answer is positive and a yes, then you want to proceed to ask them, do they have a plan to harm themselves? And the patient with the plan to harm themselves is at greater risk for suicide than the person who does not have a plan. However, both are at risk for suicide. So complications, grieving related to real or perceived loss, bereavement overload. So nursing diagnoses also include low self-esteem related to learned helplessness, or low self-esteem related to feelings of abandonment by significant others, as well as low self-esteem related to impaired cognitive, fostering negative views of self. And then we have powerlessness related to complicated grieving process. Powerlessness related to lifestyle of helplessness. All right, nursing diagnosis continued. So we have spiritual distress related to grieving process over loss of valued object, evidenced by anger toward God, questioning meaning of existence, or inability and to participate in religious practices. Social isolation, impaired social interaction related to developmental regression, egocentric behaviors, fear of rejection, and failure of the interaction. Nursing diagnosis continued. Disturbed thought processes related to withdrawal into self, underdevelopment of ego, punitive superego, impaired cognitive fostering of negative perception of self or environment. Other nursing diagnoses include imbalance, nutrition less than body requirement, insomnia, self care deficit, all related to depressed mood. And we have ourselves a question. An individual experienced the death of a parent 2 years ago. The individual has not been able to work since the death and cannot look at any other parent's belongings and cries daily for hours at a time. Which nursing diagnosis is most accurately describing the individual's problem? So, A, post traumatic syndrome related to parent's death. B, anxiety severe related to parent's death. C, coping ineffective related to parent's death. D, grieving complicated related to parent's death. And I'll give you a few seconds to decide. You are correct. The answer is D. The excessive reactions the individual continues to exhibit, such as daily crying, inability to return to work, inability to look at parents' belongings after 2 years, are indicative of dysfunctional and complicated grieving. This individual's grieving response has arrested in the anger stage and is being turned inward onto self and is manifested by the symptoms of depression. The following criteria may be used to measure outcomes in the care of a depressed patient. So, has the client experienced any physical harm to self? Is the client willing to discuss feelings with staff and family members? Has the client expressed hopelessness? Is the client able to set realistic goals for themselves? Is the client no longer afraid to attempt new activities? Is the client able to identify aspects of self-control over their life situation? Criteria for measuring outcomes for the client continues. So the client expresses personal satisfaction and support of spiritual practices. The client interacts and appropriately with others. The client is able to concentrate on reason, problem solve, make decisions. The client is able to maintain reality orientation, So they're eating a well-balanced diet with snacks to prevent weight loss and maintaining nutritional status. The client is able to sleep 6 to 8 hours a day or, at nighttime and reports feeling well rested. The client is bathing, washing, combing their hair, getting dressed with clean clothes without assistance. Client implementation. Risk for suicide. Be direct. Maintain close observation at regular intervals. Encourage verbalization of honest feelings. Complicated grieving. You want to develop a trusting relationship with the client. Encourage the client to express their emotions. Communicate that crying is acceptable. So, low self esteem is defined as negative self evaluation or feelings about oneself or about one's capabilities. These can be either long standing feelings or this can be in reference to a current situation. Self care deficit is defined as an impaired ability to perform or complete activities of daily living for yourself. So, the goal of treating clients with low self esteem and self care deficit is to assist with ADLs, increase feelings of self worth, help the client to satisfactorily accomplish their ADLs independently. And some of the interventions that we may use to promote this would be attending group therapy, teaching assertiveness techniques, showing the client how to perform activities with which he or she is having difficulty completing. Powerlessness is defined as the lived experience of a lack of control over a situation, including the perception that one's actions do not significantly affect an outcome. So, the goal for our client is to help them participate in decision making regarding their own self care and to effectively problem solve to take control of his or her life. Interventions include encouraging a client to take responsibility as soon as their own take responsibility over their own self care and set realistic goals. Client and family education in relation to the nature of the illness. So we have stages of grief and symptoms are associated with each stage. So topics for discussion with the client and the family may include the nature of the illness, the symptoms of depression, management of the illness, including the appropriate medication, stress management techniques, and ways to increase self-esteem and support. So that you may give them resources such as suicide hotline, information in reference to support groups, and here are some of the questions that you may answer when you're educating your patient in reference to the illness. So client education in reference to management of the illness. So these are the different management um, techniques. So we have medication can be administered, assertive techniques. Stress management techniques must be learned to help cope with stressors. Ways to increase self esteem and self worth. And electroconvulsive therapy or ECT may be used for behavior modification. So, as mentioned in the previous slide, they talked about referring them to support services. So, suicide hotline might be a number that you want to make sure that your clients have. You want to also make sure that they have um, support group information for depressive disorders, as well as any legal or financial assistance that they may need in the community. So the final step in the nursing process or reassessment is conducted to determine if the nursing actions have been successful in achieving the objectives of care. So evaluating nursing actions for the depressed client can be determined by asking these following questions on the slide. I will not read the questions to you, but you always, at the end of ADPI, is your evaluation to see whether your interventions that you implemented actually achieved the outcome or the goal that we set for the patient. And then either we will revise the care plan or you would resolve the issue if it's resolved, or continue ongoing if it is working and just requires more time. Here are some more evaluation questions. Again, I will not read them to you. You can read them at your leisure. And our final set of evaluation questions. Again, I will not read them. You may read them on your own. Therapy is a form of a treatment modality, and we're going to talk about several different types of therapies here. So therapy can be one-on-one environment, or it could be a group environment, and it can be beneficial to a person suffering from depression. So individual psychotherapy is also known as interpersonal psychotherapy, and it focuses on clients' interpersonal relationships. Interpersonal psychotherapy with the depressed person is designed to encourage the client to continue to work on being active in their normal activities, as well as resolving any grief reactions and recovering social functioning. So then we have group therapy, which is a form of therapy for depressed clients as well. The element of peer support provides a feeling of security as some troublesome and embarrassing issues may be discussed and resolved. Therapy group members gain a sense of perspective on their condition and encourage them to link up with others with common problems. Similar to group therapy, family therapy works with families of clients with mood disorders, such as depression, to resolve symptoms, initiate and restore adaptive family functioning. And then last, we have cognitive therapy. So the individual that's receiving cognitive therapy is taught to control their thought distortion, so that they consider to be a factor in development and maintenance of the mood disorder. So the general goal for cognitive therapy is to obtain symptom relief as quickly as possible. You may also want to assist the client in identifying any dysfunctional patterns of thinking and behaving. Treatment modalities include electroconvulsive therapy, ECT, and ECT is an induction of grand mal seizures through the application of electrical currents to the brain. It is effective for patients who are acutely suicidal and have severe depression, particularly in those clients who are experiencing psychotic symptoms or features. Those with psychomotor retardation, neurovegetative changes, it should be considered a treatment after antidepressants have been tried and proven ineffective for this client. Treatment modality continued. So we have repetitive transcranial magnetic stimulation, or TMS for short, which is a procedure to treat depression by stimulating nerve cells in the brain. So very short impulses of magnetic energy to stimulate the nerve cells in a localized area of the cortex, cerebral cortex. So it's electrical activity to the brain, very similar to ECT. However, unlike ECT, it does not generate a seizure activity in the brain. It is non-invasive and considered generally safe. Vagus nerve stimulation, or VNS, was found to improve clients' moods as well for depression. And so electronic implant, a device is implanted in the skin to stimulate the vagus nerve. The mechanism of action is unknown. Studies are still ongoing to determine effectiveness of this particular procedure. Then I have DBS, which is not on this slide, but DBS is deep brain stimulation. And like VNS, electrodes is implanted to stimulate brain functioning. Um, However, this procedure, unlike VNS, is a deep implant and requires a craniotomy. So this is invasive, likely the very last resort. Light therapy or exposure to light have been shown to effectively treat seasonal affective disorder or depression. So 10,000 lux light box. The light therapy is administered with a 10,000 lux light box, which contains white fluorescent lights and a screen to block ultraviolet rays. The mechanism of action is related to the retinal stimulation, which triggers the reduction of melatonin and an increase in serotonin in the brain. So, psychopharmacology treatment modalities. So, antidepressant medication is generally the first line of medication for treatment of depression. So, we have our tricyclics. We also have our selective serotonin uptake inhibitors or SSRIs. We have our monoamine oxidase inhibitors or MAOIs. We have heretocyclics, and we have our serotonin norepinephrine reuptake inhibitors or SNRIs. So these are all different categories for antidepressants and treatment of depression. There is a table 6-3 in your text. It has a list of common antidepressant medications. I suggest you familiarize yourself with the medications because the psychotropic medications typically have side effects that could be harsh. So understand the side effects, the action, and safety issues or any type of education you would need to teach your patient. So some teaching for the antidepressant use. So you want to encourage your client to continue this medication for at least 4 weeks because it takes time to build up in their system to become effective. They may feel like it's not working initially, but they need to continue it at least for 4 weeks. Usually we recommend 4 to 6 weeks before evaluating a different treatment modality. Do not discontinue medication abruptly. Report sore throat, fever, malaise, yellow skin, bleeding, bruising, persistent vomiting, headache, rapid heart rate, seizure, stiff neck, chest pain to your physician. For a client taking antidepressant medications such as MAOIs, there are food restrictions as well. So we have our tyramines, which are aged cheese, wine, beer, chocolate, cola, coffee, tea, sour cream, yogurt, smoked or processed meats, beef, chicken, livers, and canned figs. All these should be avoided when taking MAOI inhibitors. So you really want to know this. Usually there's a test question in reference to the foods. Additional foods to avoid include caviar, raisins, pickled herring, yeast products, broad beans, soy sauce, cold remedies, and diet pills. Pharmacogenomics. So between 30 to 50% of the patients do not respond to the first antidepressant prescription. And so studies are needed to evaluate the cost effectiveness of routine testing. So they do have testing to determine if SSRIs will be beneficial for a particular gene that the client is carrying. However, this genotyping could be expensive as well. So we need studies to prove that it is um, cost effective as well as the ability to have timely results proven so that this patient's not taking medication for 4 to 6 weeks to find out it does not work for them. So we have a question. When teaching about tricyclic group of antidepressant medication, Which information should the nurse include? A. Strong or aged cheese should not be eaten while taking this group of medication. B. The full therapeutic potential of tricyclics may not be reached for 4 weeks. C. Long-term use may result in physical dependency. D. Tricyclics should not be given with anti-anxiety agents. And I'll give you a few seconds. Tricyclic medication must be taken for a minimum of 4 weeks in order to determine the effectiveness. Okay, we have a question. A client has been diagnosed with major depressive disorder. The psychiatrist prescribes Paxil. Which of the following medications information should the nurse include in discharge teaching? So A, do not eat chocolate while taking this medication. B, the medication can cause propiorism. C, the medication should not be discontinued abruptly. D, the medication may cause photosensitivity. And I'll give you a few seconds. And the answer is C. Antidepressant medications such as Priatine or Praxil must be tapered and not stopped abruptly.